thank everyone that is joining us this morning. We'll go ahead and kick this off. First of all, we'd like to thank the Attorney General for joining us today. We're extremely honored to have you here and to see our little jewel, as we call it, that we've been working so hard to get to. Before we start our conversation, I'd like to turn it over to you, say a few words, and we'll sort of kick off the conversation. But thank you so much for joining us. It's extremely important.
Well, thank you. First of all, thank you. I thank you for recognizing an incredible need that your community, your 3 counties have, and being creative, finding the resources, and making it happen. And people are going to have better lives. People are going to live, whereas some of them may have otherwise died. And at the same time, it's not only the right thing to do, it's the smart thing to do. Because by diverting people from the emergency department or your jails, those are both incredibly expensive and inefficient ways of dealing with people in crisis situations. And to develop a facility that is made for those situations where they can be dealt with in the most effective way and most cost-effective way is really forward-looking. And so Carteret, Craven, Onslow County Commissioners, Jacksonville City Council, and of course Chief Yanero, I congratulate you. I applaud you and I thank you. Chief Yanero has been an incredible ally for me. You all know him as your chief here in Jacksonville, keeping people safe, but he is a major leader statewide. He serves on my law enforcement task force that tries to develop policy solutions to the opioid crisis. He also, as you know, was a past president of the North Carolina Association of Chiefs of Police. And so Jacksonville is well known and well regarded statewide because of his excellent service. I don't know how long ago it was, 1.5 years ago, that we had a roundtable similar to this here, and some of you were there, and we talked about how this crisis is taking lives, ruining lives, tearing apart families, and straining communities. And at that time, Chief Yanero voiced the frustration about there was no acute care facility in Onslow County, let alone Carteret or Craven. And he said that y'all were working on it, and you've executed. And so I'm very impressed. I want to tell y'all some of the work we've been doing in the 1.5 years or however long ago it was that I was here, so you can understand what steps, what progress we've made. And fighting this crisis is going to be, it's a long-term effort. It isn't a light switch, let's make this problem go away. It grew a crisis over a 20-year period of time, and it's going to take time to solve it. And we have to be cognizant of that. So some steps that we've taken in our effort to try to make sure that we have a comprehensive approach that focuses on prevention, treatment and recovery, and enforcement. On the prevention side, with Chief Yanero's help, the legislature in 2017 passed the STOP Act. STOP Act exists to reduce overprescribing, which leads to addiction and overdose. It does it in 3 ways. Medical prescribers now have to consult a database, the CSRS database, when they write a prescription, so they can see if the patient is doctor shopping, because then you have a different conversation with that patient. It's not about what your back pain is, it's about your drug dependence. Second is it requires doctors to use e-prescribing when they write these scripts, so we can eliminate prescription pad forgeries and theft. And then the third is it sets a limit of 5 days or 7 days for post-surgical of the number of days opioid pills can be prescribed for acute pain as distinct from chronic pain. And I want to draw that distinction because when you go in for your wisdom teeth or a broken arm and you're opioid naive, having a limit makes sense. There are some patients who have chronic pain for whom the limit does not make sense. And doctors have the freedom to do that under this law. In terms of the importance of reducing overprescribing, it was actually at that roundtable we had here in Jacksonville that, I don't know if you remember, there was a man who had been in a motorcycle accident, and he busted his knee and went to the doctor, and he said that within 5 days of getting his prescription, he knew he was gone. And he said 12 years he lived as somebody with addiction on the streets in Wilmington, living a personal hell. And he was fortunately, he's now in recovery, and he was volunteering, working at a treatment facility. But these pills are so addictive. For 20% of patients who are opioid naive, if they take them for 10 days, 20% of them, 1 of 5, will be taking them 12 months later. That's how they just come in and grab a hold of you. They put their hook in you and take over control of your life. For others, it's not that first prescription. It's instead somebody gets prescribed a lot of pills, they put it in their medicine cabinet, and then young people and people with addiction get their hands on it. And in fact, the majority of young people who misuse the pills, they get them from friends and family, not from the doctor. And so that underscores the importance of throwing away unnecessary or leftover pills, or if you need these pills, locking them up so that they don't fall into the wrong hands. Another major element of our prevention effort, in fact, we just unveiled this last week, and I'm pleased that the City of Jacksonville Department of Public Safety is already a partner of this campaign. It's the More Powerful NC campaign. You're going to start to see the commercials on television, on the internet. They're going to be on billboards. Has any of you seen the TV commercial yet on TV? I was working out of the gym, made me very happy to see it on the TV. And this is a partnership with Department of Health and Human Services, Secretary Mandy Cohen, and my department, the Department of Justice, and then a whole bunch of other partners, Blue Cross Blue Shield, Atrium Health are the primary ones, but we've also got the Commissioner of Insurance, Superintendent of Public Construction, and it's all about giving people the tools, the information they need to protect themselves and their loved ones. We have an excellent website, morepowerfulnc.org, and you can get the facts on this crisis. You can learn how to get involved, and that's involved as an individual. There's a pledge form of what you can do as an individual, but also what you can do as a community, and that's what you all have demonstrated here, that you are getting involved as a community. And then the third is if you're struggling with addiction, how to get help. And now families who have loved ones with this terrible, terrible disease now have a facility here that can help them. That's the second part of our strategy, is treatment, because as you all know, we're not doing a good job. I mean, we're just not. This facility is an important step forward, but it's not enough, and you all know it's not enough, because we need more places for people. You have to hand them off to folks, and if they don't have health insurance, it's very hard for them to get that ongoing care and the medication that they need and the counseling that they need. And that really underscores the importance of expanding Medicaid, accepting the federal government's offer to return the taxpayer dollars we send to the federal government to come back in the form of health insurance. We're one of like a dozen states that haven't done it. All these other states have. And this is not a Democratic or Republican thing. It doesn't need to be. And in fact, I was just at a big panel. I don't know if any of y'all came up for Rural Day in Raleigh 2 weeks ago, but Governor John Kasich of Ohio was there. And he's a Republican, and he helped his state expand Medicaid. City of Dayton, Ohio, in 1 year, saw a reduction in overdose deaths by 54% after they expanded Medicaid. Because when people need to go to that treatment, you were just telling me that this new facility here is now accepting Medicaid. That's wonderful if you have Medicaid. But we need to have people have health insurance, because if you don't have health insurance, you can't pay for medical care. 1 out of 6 people with opioid misuse disorder last year got treatment. That means 85% of them didn't. And we can do better, we must do better, and you all are doing better, and I thank you. And then the last is enforcement, and as the sheriff and the chief know, there are some very bad people who are making a lot of money selling poison to our community members. And those folks need to be held accountable. The Law Enforcement Task Force, on which Chief Yanira serves, helped us to draft legislation, 2 bills, the Synthetic Opioid Control Act and the HOPE Act, to give law enforcement more tools. In fact, I wish Sheriff Buck was here because he was one of the leading champions of getting the HOPE Act through, to give you all more tools to go after the drug traffickers. But we also have to recognize there's a difference between people who are making a lot of money trafficking these pills or heroin or fentanyl, and people whose crime is their addiction. Yes, they're breaking the law, but we have to ask ourselves, what can we do to make sure they don't continue to break the law? And the best way to do that is to break the cycle of addiction, and that's treatment. And so we need to do a better job with those folks, and the vast majority of people in jail and prison, they don't have insurance. So Medicaid would be incredibly helpful to them so that you can actually start treating them, Sheriff, when they're in your jail. And then when they get out, you can hand them off to the outpatient treatment facilities. And if people can stay clean, then that significantly increases the chances that they'll succeed on reentry and not recommit offenses. And so that's what we all have to work on. I mean, I'm proud, I'm excited, I'm thrilled, I'm impressed and grateful for the good work that you all have done. To come together as three separate counties, county and city, to work in partnership like this is inspiring, and I hope it's something that other communities in North Carolina can draw from. And I will certainly brag on y'all when I travel the state. So Chief and Mayor Pro Tem, thank you for that opportunity.
Well, thank you, and thank you again for your leadership. I mean, you have certainly recognized the need for cities and towns, and you have taken an extremely great leadership role in this endeavor, and thank you for doing that. It is certainly having an impact across our state and saving lives. And before we open the roundtable, you did mention the uniqueness of what we're doing here, yes. And we hope that others can learn from what we're doing. It is nonpartisan, and this regional effort, I think, could be emulated in other areas. And one step further from this unique sort of partnership that we form is that we also know that as part of treatment, we recognize that there's many treatment facilities, and one of the fallacies of some treatment facilities is that there's no accountability. You mentioned accountability earlier, and we all need that. And we believe that our model, which I'll ask Sherry to sort of give us a brief history on, is also unique because we have actually formed an oversight board that has developed a set of matrices that we will hopefully continue to manage and as our partner meet those criteria so that we don't have recidivism and that the expectations are being met, which I think is also unique. So I'll turn it over to Sherry Slater, our Assistant County Manager, who's been extremely instrumental in this process, and we couldn't have done it without her. So Sherry, please.
Thank you, Mayor Burton. We were working with the city of Jacksonville and Carteret counties for some time trying to find a way to make this happen. And when our new commissioners were elected and they set their goals, this was one of their primary goals. Out of 5 goals for the entire county for the year, this was a major goal. So we then had a little more weight, if you will, to make things happen. And very, very shortly, we're joined by our friends in Craven County. And this was really, in terms of getting out and getting people involved and at the table, we were thirsty for it. I mean, everyone in this room was so ready to do something to make this situation better. So they've been fantastic partners. To use the words bipartisan is almost a simple phrase for this. I mean, it's just been, everyone's been of a like mind to get this done. As counties and cities, we understand what our role is and what we're not good at, and running a facility is not our thing. So we want to leave that to the experts. And so Trillium, our MCO, was a good partner as well in this. And the decision was made in order to run it in the best way possible. We would actually work with Trillium to manage the contract because that is what they do. And so the counties and the city got together, and we are funding this through Trillium. And they bill us monthly for the cost of the facility. What isn't paid by Medicaid is billed to the counties and the city.
And what percentage will be Medicaid reimbursed?
We expect it to be a relatively small percentage, like less than 30%. It may
every bit helps.
It may even be less than that, but that's exactly right, sir. You're correct. And so Medicaid expansion would certainly make that better. but at the time, we're working with what we have. So we've all come together with that. A memorandum of agreement was approved and signed by all the parties, including Trillium, our hospitals, who we can't leave out. They've been great partners. And as a part of that MOU, we're providing an oversight committee. Not getting into the business of running the facility on any level, but monitoring the measurements that Grace spoke about, the wonderful things about the length of stay, the recidivism, the time for drop-off for law enforcement, all of those things. And they include things like making a soft handoff to the outpatient. It's not just, here's your list of things you have to do. They actually make contact, and they follow up to make sure that contact was that patient made contact.
I mean, otherwise, 2 weeks later, the same person's going to come right
Yes,
back.
sir.
I mean, so we have a strong incentive in making sure that when they leave your acute care facility, they have every chance to succeed by partnering with a good organization.
Yes.
And that's one of the reasons we engage in this MAP process, process that we paid for. That we just need to make sure that we know what the actual resources are, because we believe that after they leave here, if we don't have a solid plan, then it's really a failure. And we need to know what those resources are, where the actual gaps are, so that we can work towards that solution.
And I mean, I sound like a broken record, but there are for-profit treatment companies that are doing this work all across the country that would come to North Carolina and to Onslow County if they could be assured they would get paid. And if they're not going to, they're not charities, they got to get paid. And so to the extent they can't get reimbursed by the patients they're serving, they're not going to come. But if we have Medicaid expansion and then they can get their costs paid for, then you're going to have new providers coming, and then there'll be more people that Grace can hand them off to.
So we're very excited. Our group will continue to meet as an oversight committee, again, to review those financial records, to review the performance measures, and then to be able to use that data to argue the continued funding from our partners. So we want to be helpful not only in getting it started, but in keeping it going, and being ambassadors for the center and the good work that they're going to do here.
And what does the pro forma say that your expected annual costs above Medicaid, just the amounts that come from the public payers?
So I can answer that probably better. The public payers have agreed to 1.1 million in cash and a 200,000 in kind contribution, and then Trillium has agreed to the remainder of that, not knowing exactly what it will be. Yes.
One thing I'm doing is I am leading a multi-state investigation of the drug companies, the drug manufacturers and drug distributors who made billions, untold billions of dollars while millions of people were becoming addicted to the pills. And if the negotiations that we're engaged in bear fruit, those are resources that we want to get out to you and to other counties across North Carolina to help defray the expenses of this kind of important work that y'all are doing.
We also, Chief and I, as well as some of our other partners, continue to look for grant opportunities to build other parts of our continuum to support this effort. And so we have one grant that Trillium's actually the recipient of the grant, but it's in conjunction with Carteret and Onslow County. And then we have a grant that we just received. We haven't even gotten the grant budget approved yet through the Department of Justice, that the city and the county have worked on, that will provide that next step from the first grant. And one of the pieces in that I heard you sort of mention will be a full-time case manager in our detention center in Onslow County to work with those patients, plan their discharge services in terms of their mental health, and make that handoff just as Grace's folks are going to do from the crisis center. So we'll have a full-time person able to work with patients or with inmates or detainees, right, Sheriff? With our detainees and get them set up for the most successful exit. Because we know that in spite of all of our efforts, some of these folks who don't really need to be in jail are going to end up in jail because they're going to do things that land them there.
The number one residential treatment facility in Onslow County is your jail.
Yes, sir.
And that's true in Carteret, and that's true in Craven.
So we're going to try to get those treatment services set up so we have less recidivism there as well.
Great.
The grant also focuses on the QRT team.
Yes.
Expanding the QRT team in our community as well. So post-overdose, we're looking at what we can do as a community to follow up on those folks and make sure that they don't overdose again.
Yeah, excellent.
One of the other pieces that we've implemented locally is a program, educational program at our schools, and I'll let the chief talk about that. We're pretty proud of as well.
Yeah, actually, Mayor Pro Tem brought from the league, the National League of Cities brought in a prevention program that we started in a number of the classes. So in the high schools, they're teaching that as part of the health curriculum. They're also doing a program that focuses on folks that are going out for sports.
Mm-hmm.
So during the initial orientation, those folks are getting opioid training, and then we've had the luxury of incorporating it in our DARE program in the schools. So we're getting that opioid prevention message out to kids in both the elementary, middle, and high schools, and I think that's going to be very effective. Program is really effective, and we're glad that Onslow County Schools adopted it countywide, not just in the city of Jacksonville.
And we're doing the same thing statewide, and that if part of the morepowerfulnc.org website is a couple of different curriculums that school systems can deploy for middle school and high school on educating young people to make better decisions, avoid risky decisions. And then we have a partnership with the North Carolina Association of High School Athletics to get information out to the athletic directors and trainers so that when they talk to the athletes at the fall season, winter season, spring season, they have that conversation and let parents and students know about the risks, because high school athletes are 4 times more likely to become addicted than a non-athlete student for a couple reasons. One is they get injured more, and so they see the doctor more. And 2, they've got this warrior mentality, the sense of invincibility that they can't be hurt, and they can play around with the pills and not get addicted. And of course, as we sadly know, too many of them end up addicted, and too many of them die.
Also, as part of this facility, we'll be able to implement our diversion program that the chiefs and other law enforcement agencies can utilize once we're actually open.
We've been doing training on law enforcement assisted diversion. We have partners with the court system, and Ernie Lee, our district attorney, has been fantastic to work with. And that program will, once the crisis center opens, we'll be diverting a lot of those folks for minor drug offenses to here to the facility, hopefully to get them into treatment.
Tremendous.
Thank you. And if we can, we'll open up the floor for discussion, and we have our partners here. We'd like to give them the opportunity to say a few words. Commissioner?
Mayor Pro Tem, thank you. And thank you for being here, Attorney
Absolutely,
General.
Commissioner.
I think the Onslow County Commissioners recognized that we had a crisis situation several years ago, and the problem the issue just seemed to be so huge. How do you deal with it? And I know I met with the police chief back in 2016, and we talked about the financial impact on Onslow County of the crisis, as well as the human impact. And we set our goal, as Assistant Manager Sherry said, to get a crisis center open. We believe it's going to save the county money, and all these great partners that we have that have come in to work with us on this center has made it. I think it's going to be a win-win. I'm looking forward to seeing patients in the back, and I think it'll be a win-win for all of our partners in this effort.
Thanks, Commissioner.
Thank you. Thank you.
Well, the primary concern that I had was cost. Well, once it was kind of breakthrough for me to realize that we're already paying for the cost of it through medical and the hospital and the law enforcement hours that are lost. And then when we realized we could devote that money that we were already giving Trillium to this project, I think that was kind of like a breakthrough moment for me.
Commissioner Knapp?
This has been a passion for some time. Thank you, Sherry, for everything you did. I see four narcs in here, so they know where I'm coming from, that I worked with. But you know, we were busy. In my law enforcement career, we were busy going after the traffickers, and we kind of overlooked the people that were addicted. And it kind of caught my eye towards the latter part of my career before I retired. And of course, my wife being a therapist, that doesn't help either, because she sees that side. But we got together, and you know, this was a passion in the sense that we needed to get something up here. I remember we had a facility here, and I came with Sherry in 2016, I believe it was, and this facility was vacant. And kind of lost my cool a little bit, but we got through it, and I think this is, like you said, this is a huge first step for this county, this area. We got together with the local entities, Commissioner Farrington, wherever he's at. We talked at length. Mayor Pro Tem, we talked at length. We shared the same passion, and we decided to get together. And to me, this is the prime example of how government entities, like you said, regardless of political affiliation or whatever, got together, put their heads together, found a way to get this done. And I'm extremely proud of this facility and all the effort that was put into it, because our community is going to benefit from this. And they can tell you too, the last 2 years of my career, the biggest drug dealers that we were chasing were people in pills, trafficking pills and heroin. And so this does my heart right, and I'm very proud of all the efforts of everybody involved.
Thank you, Robin.
Great.
And as we mentioned earlier, our hospital, Hounslow Memorial Hospital, has been a significant partner of ours, and we're very proud to have them as part of our team. So, Penny?
How exciting is this?
Yeah.
And I love what you just said. You made reference to this being a first step. It is a first step. This isn't a one and done sort of thing. We see at the hospital, we see in our emergency department, people when they are at their most vulnerable. So they come in typically with a mental health issue, but understand that the substance abuse piece of this is self-treatment oftentimes. So how great is it that we literally would see them, hold them in our emergency department after law enforcement would typically bring them to us, sometimes 7, 10, 14, 21 days looking for placement. And it's doing a great disservice to the community. This, which represents an incredible collaboration among community leaders across counties, amazing, is hope. But again, it is a first step. So thank you so much to all of you for the efforts that you put into this. I'm window dressing. I did nothing compared to what all these people did. So thank you.
Sheriff Miller?
Well, I wouldn't go that far, because the hospital is so much a part of this partnership that we see between the city and the county and other counties. And this partnership will set an example, hopefully, for the state, because we have people in jail that drugs and drug abuse and drug peddling brought them into the jail. Now, there's two prongs to drug abuse. The people that are addicted, that is a disease. That is what this facility is for. The people that are supplying the poisons to our people, our young people, our older people even. We have to be very aggressive in taking away the money magnet for those individuals that supply that poison. But I think we do the best we can with the partnership that we have. And I'm so encouraged that we have this facility. Grace, we're looking very much forward to the increase in operation of this facility. We're working with the city, with the Jacksonville City Police Department, with other police departments in the county, and also with other counties as well. Because that's what it takes, a partnership for the right reason. And hopefully the jail population will get that treatment once we get that additional professional on the staff, because we don't want to just put somebody out in jail. We want to prepare them for a better future, away from drugs and away from alcohol abuse. And drugs could be illegal drugs, methamphetamine, heroin, and all the other illegal drugs, but also the prescription drugs. And I'm really glad that the state has stepped forward with the HOPE Act and made a difference. we have got to work together. We will work together, and we're going to be partners for the people.
To echo what Sheriff Miller said, in my 40-year career in the courts and law enforcement, we've never seen a drug addiction issue in our part of the state like we're seeing, and countrywide, that's having the profound effect. And law enforcement officers oftentimes see it first on families and children. And to have children who can't wake their parents up, some who never wake up, and have children being raised in that environment, and us realizing in enforcement that bringing them into the court system and putting them into jail and letting them back out without some type of a support system, some type of a treatment plan, is not going to be effective. So it is extremely encouraging to see this type of cooperative effort, because these three components are like links of a chain: prevention, treatment, and enforcement. And they all must have equal strength, and we appreciate the opportunity to see the multi-county collaboration in addressing what is just an incredibly, when you look at the statistics and realizing more people will die from opioid addiction overdoses this year than in automobile accidents, it's just incredible. We haven't seen anything like it. So this is a tremendous first step that hopefully we can build on in our three counties.
Thank you. Commissioner Barrington?
Well, as everyone has already said, it's just been a great partnership. Like Commissioner Knapp had mentioned, it kind of started off at a round table and evolved into being invited by Onslow County and by their commissioners, and then of course the city of Jacksonville. But as Sherry also mentioned, the hospital partnership is awesome. I mean, Onslow Memorial being right next door to this facility is just a great thing. The great thing is that hopefully the police cars will come past the hospital and pull in here directly, and then Carteret Health, and of course our partnership with Craven County as well. But you also you were on a tour when you came here 2.5 years ago, when you first were elected, I guess. You met us at the health department in Moorhead. Mm-hmm. And one of the things that I said, and I'm a dreamer. I mean, I guess I'm maybe naive, but all you see is statistics. You see really, really bad statistics down in Wilmington. I mean, it's a highly populated area. It's part of the Trillium and catchment area. We're 26 counties. Is that right? That's right. And I'm also on that board as well. And I think what we need to focus on, and what we have focused on, is we want to make those numbers go down. Mm-hmm. We want to drop those numbers, and we're just at the beginning of it. We really need a big neon light that says open 24 hours here, because that's what it's going to be, and that's going to be pretty impressive. So I'm really excited, and I'm really excited because our commissioners, as well as the other counties, jumped out on a limb and said, we're going to fund this. We're going to get in this partnership, and we all agreed to do it for 2 years. I mean, technically, we can't really do it for anything more than a budget cycle, but we all said we're all in this for 2 years plus. Mm-hmm. And I am looking forward to making sure that our money is well spent. Grace, you can tell already, she was explaining how things were going, and it was like a domino effect. Everybody's saying she's great. She does a great job of doing it. One of the things that I think I missed at the very beginning when she first was introduced to you was what are the time of handing someone over? You were telling us about that before. Can you just tell us that real quick?
Of course. So our expectations for all law enforcement and first responders is that they get in and out of our building in under 15 minutes. That is our expectation right now. That is very high for RI International standards. Our facilities in Durham and in Henderson do this process in 5 minutes. And then our Arizona site, which has been a site that we've had the longest, the last time they were clocked was 2 minutes and 10 seconds to get a first responder in and out of the door.
And that I tried to explain that in one of our meetings. And I mean, that's unbelievable. That's great. And that's all I want to say. I'll leave it at that. Thank you for being here.
Thank you for your work.
Commissioner Meyer?
Sir, thank you very much, you and the governor, for what you're doing to push this forward. First of all, I'd like to thank my manager, Jack Veit, and Sherry for reaching out to us. I mean, if it wasn't for Sherry and Jack getting together, and at the time, the chair, Tom Mark here, we had a problem. We had a real issue. We had 7 overdoses in one weekend resulted in 5 deaths. And that woke the board up, got us our attention. We were concerned of what we were going to do. We knew we couldn't do it alone. It was just too big, and that's when we got word from Sherry of what they were trying to do, and we jumped on it. The past chair, we brought together a committee. We had over 100 organizations joined a committee in New Bern, that we've got 5 subcommittees out of that and moving forward for different steps and different process. Our partners, we've partnered with Carolina East Medical Center, who's come aboard with us, who's helping us fund this, to get funding to go forward with this. Sheriff, I think, 3 weeks ago, we had another 7 overdoses. I don't think we had any deaths in that one for the one weekend on that one. And that's just luck and on people being there and everything else. And I think what people have to realize, 70,000 deaths of this disease or this dope that's being put out there, put it in terms, 70,000 in 1 year. In 10 years, we lost 59,500 in Vietnam. In 10 years, 59,500. We're losing 70,000 a year for this stuff. We're losing, 500, 600, 700 a day. Our largest operation in Vietnam, our worst day in history, was 349 soldiers, Marines, sailors killed in one operation. So put that in perspective of what we're losing yearly. We just can't, we've got to do something. We've all got to come together. This is a start. This is a start that we've got to grow and make bigger, because we have to have a place for them to go to stay on it. I mean, 16 days, 15 days, this is a life cycle change that somebody's got to keep them on track for the rest of their life, because it's easy to slip, just like alcohol. I mean, you've got to have a program. So I'm grateful for the leadership you're providing, sir. Slater, Sherry, I can't thank you enough for what you've done and everything else.
Thank you, Commissioner. Commissioner Cavanaugh?
Yes, thank you, sir, for coming down and for your continued interest and leadership on this issue. It's always great when everybody gets on the same page and works together instead of trying to tackle a huge problem like this as little individual government groups or entities. You talked about a multi-pronged approach to the problem. My emphasis is on the education. In Carter County, we've bought into a program that starts at the grade school level, as early as 3rd grade, before kids start forming their peer pressure groups, and indoctrinate them or educate them on drug awareness and problems, and hopefully this will nip the problem in the bud before it blossoms down the road to where they become athletes, and when they'll be able to recognize when they're maybe on that slippery slope and get turned around. Anyway, again, thank you for what you're doing. You gals are doing great down here. Very impressive, very impressive.
Thank you.
Thank you much.
I think that the chairman described basically what I would have said, but I think one of the biggest things that I've gotten out of this is making an awareness with the public. The public really didn't understand the magnitude of what this has done in the United States. And by us and the Attorney General being here today, this certainly points out that we have got a big problem. And I can't say more about the 3 counties that got involved here. When we were approached with this, we grabbed it right away. But I also want to make a statement that this is not a short-term thing. We've got to look at this as a long-term. These people coming out of here, I've got to have some other place to go. And that's not a 2-week deal or a 3-week deal. It's a 3-year or a 5-year deal. And I think that we have got to look forward to that happening. And this is great as a start, but we've got to take it further. Thank you.
Thank you very much. And I guess one of the other pieces that I'd just like to touch on is sort of our next phase of conversation is the community engagement piece. Chief and I are working together to try to get partners in the community that basically involve the faith community, the business community, and then, of course, the housing community, because we also know that as they leave recovery, some of them may have some criminal history, and finding housing and employment can be difficult, most oftentimes leading them back to use. And so we believe that this is another critical piece of the recovery process, and so we're engaging our community partners to bring people on board that will assist in this recovery effort, that will not only lead people to faith-based recovery, but also employers that are able and willing to hire these folks and give them a chance as they move along their path of recovery, and also housing partners that don't require, non-felony sort of history in order to be able to get adequate housing. So these are other pieces that we've really got to talk about and try to find solutions for, because if they leave recovery feeling great and 100% and moving forward in their life, if they can't get a job and they can't find a place to live, it always leads them back to what they know. And so we've got to find these solutions. So once again, thank you all for joining us today. Thank you for joining us today, and I'll give you a few moments for closing remarks, and we'll conclude.
Thank you. Well, again, I'll underscore my appreciation and the degree to which I am impressed by your collaboration, working among counties, county and city, with the hospital, with your provider. This is what it's supposed to be. You all are doing exactly what your constituents want you to do, which is to identify a real problem and then creatively and conservatively manage the tax resources to try to attack it. And I congratulate you. I'm very impressed. The chief was just telling me when I walked out of my car, how many overdoses did you have this weekend in Jacksonville?
We had 3.
3 overdoses. And
We had 1 death 2 days later.
this problem is current. The fact that this thing's about to open doesn't mean it goes away. It's going to require sustained engagement. And there's going to be a time when the cameras don't focus on this issue as much, because there's going to be another issue that comes along. And just the way, you know how it is. People's attention span is so long. But I encourage you to stick with it. Just as the Commissioner Mark said, this is going to take sustained engagement for us to turn the tide. And thank you.
Thank you very much. This concludes our meeting. Thank you.
We lose about 5 North Carolinians every day to an overdose. In fact, just one in Jacksonville this weekend. And to attack a problem that deep-seated and complex, it requires a comprehensive approach. Prevention, treatment and recovery, and enforcement. And on the prevention side, we just rolled out morepowerfulnc.org, a partnership with the Department of Health and Human Services, so people have the tools that they need to protect themselves and their loved ones. But treatment is really important, and that's what this facility is going to do. Is people who have substance use disorder, addiction to opioids, they can come here and get that help to start the process of turning their life around, and it is a wonderful development.